Well, the New Deal was enormously successful in eliminating bread lines and chronic hunger in the United States and substandard housing and the list goes on. It was great at taking care of basic material goods that we all need in a modern society and providing that kind of baseline level of support, the safety net. But we're in a new world now. We're in an affluent society, even in economic hard times. And so we need a new deal, a new deal, a real deal, which addresses the things that are stressing out American families. And those happen to be, unfortunately, what Fred Hirsch once called positional goods, that they often have a relative nature. So what's the highest portion of household budget today? It's housing. And it's not because we can't live in shacks anymore with indoor plumbing without spending half of our income. It's because we want more and more housing, bigger and bigger places, and we want to be in the, quote, best neighborhood, which of course is a zero-sum game because not everybody can be in the best neighborhood. And this cycle, combined with increasing inequality, drives household budgets and drives economic anxiety today. Think about the things we spend our money on. Education. It's both a status good, it's a relative nature. You know, you want to go to the best possible school and for the highest possible degree. And if everyone had that degree, then it wouldn't be like a high school diploma today. It wouldn't be worth much. So you need to do better than everybody else. And it requires intensive, high-skilled human capital investment. Healthcare. Not a status good, not a relative good, but still because of a lot of reasons. That's a very technical field, but also because the doctors have had a stranglehold on, for example, writing prescriptions, prescription authority, that it's incredibly expensive because it's intensive, high-skilled capital, one-on-one interaction that you need. So any real deal will try to de-skill, that is, disintermediate things like education through open source technology, de-skill medicine to the extent that nurses or medical assistants even could write basic prescriptions for antibiotics, so you don't always need to see a doctor, for example, or you could interact with nurse practitioners over the web, or a different model of healthcare delivery. So we need to do that, but we also need to sort of address the relative aspects, which is really a trickier deal. We have to de-emphasize or at least re-engineer the relative aspects of housing and education and so forth. Traditional approaches to, New Deal approaches to social insurance was to guarantee a minimum level of consumption in the case of old age, i.e. Social Security, or in case of unemployment, or in case of widowhood, which was the original function of welfare. Today, what we're really trying to do, I think, is provide equal opportunity, or at least maximal opportunity for all Americans. And to do that in a post-industrial knowledge economy requires a different kind of social contract. And I think rather than focusing on marginal tax rates or how much the rich theoretically pay, not even actually pay, theoretically pay in their tax bill versus middle-class folks, we should think about, well, how do we stitch those folks together? And one idea is to link them in virtual town halls, if you will, where their fates are really linked by being randomly assigned to social groups that integrate online and make decisions like a small New England town, which is the roots of our social policy, where folks have to take care of each other through taxation and voucher and exchange and electronic transfers and so forth, through taking care of the education of that 1,000 or 10,000 person group, the kids in that group, by levying a tax within that group and then giving that tax out as vouchers to the kids in the group, for example. I think if we decentralize and bring the scale down to something where trust and empathy can develop maybe it's 1,000, maybe it's 10,000, maybe it's 500 even. I don't know what the right number is. But the key is that folks can't opt out of it. You can't have the rich just saying, I'm going to move out of the city and to the rich suburbs to not deal with those people and pay taxes to support those kids, or have my kids sit next to them in school. Or I'm not going to even send my kid to a public school. I'm going to send my kid to a private school, and therefore my support of public education declines. By having it be this online network, but non-voluntary, assigned at birth, I would hope to restitch some sort of civic society beyond bowling leagues to promote opportunity. That's one idea. A second idea is to promote an asset-based policy or an opportunity agenda that focuses on thrift and savings rather than on supporting basic material consumption. And a number of scholars over the last 20 years have tried to promote asset-based policy where poor people are not just supported in terms of having enough food through food stamps or women, infant, children's program, but also are able to save through matching funds, for example, or are provided with a seed funds for assets to save to start a business, go back to school, buy a home, what have you, to really promote opportunity. And then another dimension of that kind of policy might be that we have a sovereign wealth fund for the entire United States that we each, by nature of citizenship, own one share of, and we can decide through a shareholders meeting what kind of investments that sovereign wealth fund will make, whether that's in this technology startup or that company, or the education system, or fixing our national highway system, or what have you. So I really think there's potential for a ongoingly negotiated social contract that's made possible by new media.